day to everyone and welcome. It's a very, I am very glad today with the event that we are going to have today, the presentation of the book A Todo Corazón, Código, Infarto with the Dr. Gabriela Borrayo Sánchez. The Dr. Borrayo, I would like to thank you of thinking of CS for making the presentation of this book. And I would like to extend these greetings and say some words on why such a piece of this nature is presented at the Inter-American Center for Social Security Studies. Indeed, the book is a compilation of scientific articles related with cardiovascular diseases. And briefly, I was asking the author on the reach of this book, and I believe that there is an fundamental element, and it is that it articulates the reason and objective of this book, and that coincides with the reason of the existence of the Inter-American Center for Social Security Studies. Social Security fundamentally is preventing and prevention. And I believe that the text gather very important articles and recommendations on what prevention means and the effects on the disease, the cardiovascular diseases, as one of the main death causes in the case of Mexico, the main one. But all the countries that integrate the Inter-American community, we have the same difficulties and the same behavior, and the behavior is not different. Therefore, this book is very important and constitute a sum for the member countries of the conference, as well as the public in general. And it is grounded in generate a great knowledge of a great deal of knowledge and conscience regarding the importance of the care. And when I was saying that I was talking with the author, she said that from the infancy and the adulthood, I remind that the social security must cover the human beings since before they are born till they are dead. So this work and why is the author presenting it in the Inter-American Center for Social Security Studies? It's really important. To the doctor, our congratulations. For those who have worked at academy, we know that each book, it's like children. And normally the birth of the book is even more painful and harder than the childbirth. And it is very important that this book will constitute a reflection, and they have to be useful for the population. And we believe that this book gathers all these requisites. Gwendolyn Bravo, research coordinator, is with me today, and the Dr. Edgar Daniel Manchinelli, who will make the comments of this book, is also with us. I thank the doctor for being chosen the center and invited to the presentation of this book. I believe that it's going to be very interesting. And this interest shouldn't be only in this event. We have to read them, think and reflect on this the content of the book. And in the case of the Social Security institution, they should act. They should organize programs that respond to this. I haven't read the book, but I will read it, and they will make reference to programs and activities that has been developing, particularly at the Mexican Institute of Social Security, which make it even more valuable because it's not only an abstract reflection, but it responds to a concrete reality. Doctora Borrayo, welcome, Doctora Borrayo. And I wish that this book will have a very warm reception. Thank you very much. Thank you very much. Thank you very much, Dr. Carrasco. I welcome Doctora and coordinator of this book, and I'm going to organize. I would like. I'm going to present quickly Doctora Gabriela Borrayo, who is a specialist in clinical cardiology with a master's degree and doctorate in medical sciences from the National Autonomous University of Mexico. She also did a master's degree in administration from the Universidad del Valle de Mexico. She's head of the Health Innovation Coordinator of the Mexican Social Security Institute, creator and head of the todo, corazón, código, infarto program of IMSS. She's member of the National Academy of Medicine of Mexico, of the National System of Researchers. She has been the first woman president of the National Association of Cardiologists of Mexico for the 2020-22 biennium. She is also a member of the National Academy of Medicine of Mexico and of the National System of Researchers. She's also a member of the American College of Cardiology, European Society of Cardiology, and the Inter-American Society of Cardiology, among others. We thank you, Doctor, and I give you the floor so you can present your book. Thank you very much. For me, it's a pleasure to be here. I thank the invitation, and I'm going to start with my PowerPoint presentation. This book resumes a lot of what we have done at the Mexican Institute of Social Security. And I'm going to tell you why the title. Nowadays, this is a program of the Institute, and for sure sharing it at CS will help us to transmit to Latin America this proposal that today is a reality at IMSS. Well, definitely, cardiovascular diseases are the first cause of death before and after the pandemic. Even you can see between the year 2000 and 2019, how the mortality of cardiopathy is the main disease, the main reason of death, according to WHO. There are 19 million of deaths in 2020, which means an increase of 22% in the past 10 years. And it is estimated that at 2030 will be 20.2 millions of deaths. This means that the 32% of the global deaths will be for this reason. In Latin America, these diseases are very they cost a lot, and it is estimated that towards 2020. So this is what it means. The first cause, a heart attack, and in Mexico, it's with as you can see in the graphic, that is a 27% and our country during the pandemic in 2021, they were 70% for a heart attack, and in the Mexican Security Social, that we have a responsibility of more than 70 million people. And now even more with IMSS Bienestar, we have that since 2015, it's the first cause of a healthy life lost by premature death and unavailability. And in 2019, there was 19 million of consultation, more than 90,000 egress. In Mexico, we have one of the most people that is staying at the hospital. So it's a very relevant topic in Latin America. You can see here that in pre-pandemic, in the green line, the mortality rate was lower in our country, and we kept that just before the pandemic in comparison with all the people who didn't have social security. So it's a guarantee, the simple fact that we have social security. In 2021, we saw in post-pandemic times that it was raised, all the death causes were raised by 50%. Why is it this? Because we have a more important burden of the disease. In the post-pandemic, we can also see that the people who have social security has less mortality rate, but in the post-pandemic and during the pandemic, we have a more an increase of the mortality in those who didn't have social security. Nevertheless, it's really worrying because that 50% occurred in all worldwide. Latin America was no exception. We have the first three mortality causes in Mexico: diseases by heart, cardiovascular diseases, then COVID-19, and then diabetes. So as you can see, the increase was really big. Within men, it was the first cause, and in the women was one of each 5. So it was, cardiovascular diseases are the first death cause in Mexico. And why is it? This because our population is high risk. We have, especially in the north, in the Gulf and the Southeast, a population with high prevalence of obesity, diabetes, and hypertension. The problem is that these factors are some. We have more than 50% of the adult population that has more than 2 risk factors, which predispose to have a heart attack, cancer, or osteomuscular diseases. Therefore, this program was raised, that it was proposed since 2014. We started in 2015 with código infarto with 3 axes. The first one was the promotion of healthy habits since childhood: a healthy diet, physical activity, and a promotion to avoid addiction, as well as the knowledge since childhood of these risk factors. The second axis is the detection and control of obesity and diabetes. The third axis has to do with primary prevention. When we have already a high risk population, especially with adults older than 20 years, we have a 50%. So in that case, we have to prevent that the heart attack rise. When the heart attack arrives, we have 2 axes. The fourth one is the first contact diagnosis, and the fifth with the reperfusion. So with the reperfusion, and it's a standardized protocol for the Mexican Institute of Social Security, which was the first one who launched this protocol, and nowadays saves lives. The 6th axis has to do with attention and prevention of complications. And finally, the second axis is the rehabilitation. So we had this is the context of this book. And Código Infarto is the first part. So the book, that is why the book that I am presenting right now is called A Todo Corazón, Código Infarto. So we are going to focus on the fourth and fifth axis. So in that sense, the book is stated as way. We have a presentation, and then, as you can see, you have these chapters. The first one is what is this program? The second chapter is the public policies for the prevention and the control of cardiovascular diseases. The third and fourth chapters is related with obesity at childhood and the nutritional state of children in Mexico. The fifth chapter is management of emotion in the infancy. The sixth is when the risk factors initiate with the teenager period, the drug consumption, the impact of a cigarette in cardiovascular system, diabetes as a cardiovascular disease. And finally, we have a proposal of a Código Infarto universal. So we have the presentation that Dr. Luis Alcocer Diaz Barreiro made, which is a teacher of a lot of us, and he has a global focus on public health, and he's very updated in these topics. He has a lot of years studying these topics. I thank you very much him for this presentation. Dr. Germán Fajardo, which is the director of medicine faculty at UNAM, made a prologue where you can find all the context of the cardiovascular diseases as the first death cause, and especially what we can do at the preventive standpoint. Of course, I thank a lot of my family, my parents, my children, my husband. I also thank the Mexican Institute of Social Security, at the cardiology hospital, the IMSS Foundation that made possible this book, and especially to the National Association of Cardiologists in Mexico, ANCAM, that allows us in the first place to have the opportunity to be the first woman that I was allowed to be the first woman president. And they allow also to gather towards the prevention for the population, reach the population, update our physician, not only in cardiology topics and its specialties, but also the general doctor, specialists, psychologists, nurses, therapeutics, because we need an integral approach, because all of us, we participate at some point in cardiovascular health of the patients. So we have here the 7 axes that I was saying, especially we want to highlight that this is a multidisciplinary book. And in this sense, you can make a first contact diagnosis in less than 10 minutes with the nurses and the regulatory center, and where time is really important, it's crucial. And so in less than 10 minutes, we make the diagnosis so we can act. Medicine, we include the 3 levels of attention, and the first thing they have to do, they apply the firinolinium. So that is a concept. Time is muscle, and muscle is life. So that is a concept of applying the therapy in less than 30 minutes, even though it ideally should be in less than 10 minutes. Or invasive therapy, which means a coronary intervention in less than 90 minutes. But if we are in a hospital, this shouldn't be more than 60 minutes. After the application of these therapies, we have a very important strategies that is a pharmaco strategy. We're going to take the patient to a room where we can gain time and help the artery in so that in less than 24 hours, we will leave the artery without lesions. That will allow us to have an adequate flux of blood. So it's so wonderful that the heart can recover that muscle that has infarcted, that had a heart attack. So these are the chapters, some of the chapters: public policies for prevention, avoiding tobacco, the nutritional state of the population, the management of emotions since childhood. Each of the chapters was written by experts in the topic they wrote, and we gathered them, all of them, to give a very holistic message and a specialist with each of the topics. Management of emotions, mental health, they are very important topics that we have to highlight. Drug consumption, which nowadays we know that is a cardiovascular risk. The use of cocaine, of marijuana, all of that can deliver a heart attack. The impact that tobacco has, diabetes as well, hypertension, and as well as some other diseases that promotes heart attacks. Of course, you have the combination of all these diseases may predispose the system, and it's a condition that leave us that leave the patient the high risk. So when we intervene timely, it's crucial to avoid a mortal disease. We can also map where are the risk factors and Mexican populations. We have also gather what public policies can we have at a national and a regional level, the risk scales, how can we improve the prognostic, and how can we prevent heart attack in the population that has already a risk factor, a high risk factor. We made some attention webs, and this is fundamental because the communication between the first and second and third level saves time. We can be more efficient, and we can give the therapy more opportunity. No doubtly, diagnosis is fundamental. Identify the first symptoms, to think that person is having a heart attack. The electrocardiogram, which is the very opportune tool to make the diagnosis of a heart attack. The medical attention algorithms, the clinical diagnosis of the heart attack, for example, can save lives, as we were saying, since the first level of attention. The primary angioplastia, that toward 2003 was the hit, that we are not going to use the fibrinolytics, but it's very important to use them. This pharmaco-invasive strategy that allows us to gain time and to lead the patient towards a coronary intervention. Never, doubtless, at helping therapy, it's also very important. The blockers, so the patient have integrally all the attention. Doubtless, COVID-19 changed the history of the heart attack, changed the opportunity in the treatment because the people delay more to go to the hospital, even they stop going and they die at home. This episode that we have been living these past 3 years is a challenge for all those who are helping prevent these cardiovascular diseases. Another very important aspect is what happens in the intensive therapy that since the 80s, low decrease the mortal rates. So it's a very important fundamental scenario for the prognosis of the patient. The difference that exists by sex, the cardiovascular risk in the women are higher than the men. More than there is a very important difference between men and men, and the single fact that being a woman is high risk. So we have a chapter on this context, the mechanical and electrical complications during the first 24 or 72 hours when there is an insufficiency of the heart. And there is also a chapter of the cardiogenic impact, and there is another chapter of the early heart rehabilitation will allow us to be that the people can have a normal life and a better quality of life. With all of this, we make an important for all the challenge for the secondary prevention. We must avoid this new event. We also tell you how what was the impact of the protocol of this código infarto attention, and finally we have in the last chapters what happened after suffering a coronary deep syndrome regarding mental health. And the last chapter is called Código Infarto Universal, which is like a recapitulation of all this, the book. And so we have all the information of the actors of this book. So I'm going to tell you what happened with this book. This image, we have already seen it, but I want to highlight the attention web. The first web, we made it in the Siglo XXI hospital, where the protocol established that the 3 levels of attention, they must be very well communicated and they have to act quickly for the diagnosis and the repercussion. We have new technologies in this protocol of Código Infarto. We have one in IMSS, digital IMSS, where you can see that is Código Infarto. So when you enter this, you can find the geolocalization of all the units that are related in each of the web or Código Infarto webs. We can geolocalize and calculate the time to arrive to each of these units. We have also the regulatory center, 2 in the metropolitan area, one in La Raza Hospital and the second in Siglo XXI Hospital. So this is a positive final area where Código Infarto reduces mortality in a 64%. We have 6,000 lives that were saved with this program. With Código Infarto, we have before Código Infarto, we had 21.8 million percentage of that, and nowadays we have 7.7 percent, so less than the average. We have saved a lot of lives, and we keep doing this in a holistic way at the Mexican Institute of Social Security. Nowadays, we are sharing this protocol with IMSS and other institutions that have asked this support. And I want to say as well that this protocol has been shared with other countries such as Dominican Republic, Chile, Paraguay, and Colombia. So this is important because this way of working can be made in the Social Security institutes where we can establish webs coordinately. Well, I only want to thank you. This is a very presentation of the book. We're going to leave the book at IMSS if you can come for them. We are not selling it right now because it is an effort that was made by IMSS and the author as a contribution, and with the greatest wish that this will arrive to the hands of those who are studying medicines or making some kind of cardiologist specializations, rehab, and as well all the group that collaborate in the patient attention and the opportune treatment and diagnosis, because it is a change, and all of the people who participate contributes for saving lives. I am sure that they are going to save a lot of lives, and I'm sure that this book will be one of the greatest opportunities and tools that will help you to attend the heart attack. Thank you very much, Doctora Borrayo, for this very important effort of resuming this book. Indeed, it's very technical, but it's very important for the formation of the specialists. And well, the invitation that Dr. Borrayo made, we will have some books here at your disposal in the audience. I'm going to give the floor to Dr. Edgar Daniel McKinney, who is a specialist at the American Commission on Health, Wellbeing, and Social Security at IMSS. He's going to make the comment of the book. Please, Doctor. Thank you very much, Doctora. First of all, I would like to thank Dr. Borrayo for having accepted the invitation to present your book at the Inter-American Center for Social Security Studies. Thank you very much. I would like to emphasize that this type of event is essential to disseminate the scientific production of experts. In this case, I am pleased to comment this text, which brings together a series of relevant research studies on cardiovascular diseases. These studies are useful for academic research, but also for the medical staff that treats these conditions in clinics and hospitals. So we have two dimensions, one theoretical and one practical. In general, the book is composed of 35 chapters, which mainly address all the risk conditions of cardiovascular disease. In this sense, there are chapters on risk factors such as obesity, hypertension, dyslipidemia, diabetes, smoking, and sedentary lifestyle, among others. In addition, these risks are observed through their effects on age group, such as childhood, adolescence, and adulthood. Likewise, there are chapters that highlight the emotional part in childhood and depression and anxiety when suffering an acute coronary syndrome. Then there are chapters that focus on treatments such as fibrinolytic therapy and adjuvant therapy. Finally, the book includes a section on the impact of the COVID-19 pandemic on this type of heart disease. As we can see, it is a very complete book on the subject. It should be noted that this book is part of the Código Infarto program at the Mexican Institute of Social Security, which seeks to strengthen comprehensive care attention to reduce the impact of cardiovascular diseases in at-risk population. This program is conducted through the 6th dimension of quality, in that it is safe and patient-centered, timely, efficient, effective, and it is equitable. As a result, according to Dr. Diaz-Barreiro, this program has resulted in a reduction of 60% in mortality, in addition to a reduction in patients staying in intensive care and hospitalization, making evidence its profound effectiveness in heart health. This program that has been implemented since 2015 to address an emergency situation in Mexico, which has already been highlighted at OCDE in an OCDE report as the country with the lowest performance in SAR. So it is important to evident in a scenario in which this disease is the leading cause of death in Mexico. This program makes possible to attend people at all the time, at any time, in an agile and timely manner. Since previously this depended on the rigidity of the stratification of the level of cares, as Dr. Luis Diaz pointed out, this resulted in high waiting times of patients, putting their health and well-being at constant risk. In other words, the design and implementation of this program is evidence of a paradigm shift with respect or regarding to health management in the treatment of cardiovascular diseases. This is that having a crisis expressed in the high mortality due to these heart conditions, the old organizational paradigm was adjusted to accommodate an administrative revolution in hospital management, and thus establishing an innovative model that has palpable results, even avoiding corruption, as Dr. Luis Diaz rightly points out. I would like to comment one of the chapters which I find significant. It is called A Todo Corazón, Código Infarto. In this chapter, the author discusses the reason why the program A Todo Corazón is important, which objective is to reduce the health impact of cardiovascular disease by optimizing the treatments in clinics and hospitals. So it includes changes in organizational and health management processes based on the participation of the medical and administrative staff. To achieve the above, this program contains 7 axes. The first one, promotion of healthy habits from infancy onwards. Axis 2, detection and control risk factors. Axis 3, primary prevention in patients at highly cardiovascular risk. Axis 4, first contact diagnosis. Axis 5, reperfusion, hemodynamic wards, and fibrinolytic therapy. Axis 6, care and prevention of complication. Axis 7, rehab and secondary prevention. It should be noticed that the first axis is directed toward the promotion of a healthy diet, physical activity, management of emotion to reduce addiction, and a practical knowledge of the body and the heart. In addition, the second axis addresses the control of risk factors such as overweight, diabetes, hypertension, dyslipidemia, and smoking. The mission of both axes are to educate and contain this risk factor by promoting a healthy lifestyle and a less harmful lifestyle. It should be noticed that these risks can produce continuous and profound damage throughout people's life. Such scenarios depend on a series of social conditions such as occupation, income, age, educational level, gender, and ethnic group, among others. Thus, risk and their effects, such as unhealthy lifestyles, responds to the stratification of society, where the majority of the people are generally at a disadvantaged situation, and some are even socially excluded. Hence, the importance of public social security in reducing the risk factors that generate unhealthy lifestyles in people in disadvantaged social positions. Furthermore, it should be added that these risk factors are also determined by the body and a food culture that is linked to the expression practiced by social groups according to their own traditions. Food security, which is the physical availability of nutritional food and its economic and recurrent access over time. And finally, there are the commercial determinants of health that refer to the goods sold by business actors that impact on people's well-being. These social, cultural, physical, and commercial circumstances of health where people are born, grow, live, work, and age are the basis of the risk factors, in this case corresponding to the heart diseases. Thus, for example, obesity prevalent in a stratum or, or at an entire society cannot be fully understood without including these circumstances that shape people's health. With respect to their product, in part, this does not mean that the circumstances that force this risk factor are eternal structure in time and solid structuring factors of unmodifiable attitudes and behaviors, but rather that they also have to have the possibility of transformation. Circumstances are not eternal entity. Thus, changing attitudes and behaviors is possible to the extent that governmental public policies are of quality based on effective design, planning, and following up. Thus, the fight against the risk of factors of cardiovascular diseases should be carried out by means of long-term policies that promote a healthy lifestyle in a comprehensive manner. This means that they should involve the intervention not only of social security institutions, but also such as those in charge of sports, work, communication, economy, and healthy food. In other words, in order to be fully effective, programs require an interinstitutional approach focused on people, also called intersectoral policies, since the risk factors for heart disease are based on health determinants. And this is the subject of the second chapter by Dr. Olga Georgina Martinez Montañez. Further, principally is the expression of a change of paradigm in the attention protocol of cardiovascular diseases in clinicals, and they have this is indispensable, the continuity and the development of the Act 1 and 2 based on the relationship of other public policies, the confirmation of more healthy lifestyles, because if the alimentary security is not complied, why educate children and adolescents in a healthy lifestyle when people does not have access to healthy food? Thus, indeed, the analysis of patient accounts of their experiences in clinics and hospital can offer a thematic range for improvement with respect to health management processes. This is about a humble proposal to include a sociological perspective in studies on cardiovascular diseases. I would like to thank Dr. Gabriela Borrayo once again for coordinating a masterly book, for which I am sure that these various studies will help the specialist public in both practice and theory. Thank you very much, Dr. Manquileni. Thank you, Dr. Borrayo. I would also like to thank you to share this book and the presentation here in IMSS. In the chat, we have congratulations, more than questions. Thank you very much for sharing the book. There are several questions whether this book, they are going to find it on a digital level. We are going to share the email of Doctora Gabriela Borrayo, but I would like to share with you a comment that is very important. We have in Costa Rica the capacity to present it in the editorial council of the Costa Rican founding, and we could collaborate in the impression of more exemplars. So I will leave the email of Dr. Borrayo. Thank you all that accompany in the presentation of this book, and the comments of Dr. Manchinelli. Thank you very much. Thank you very much.